Hello friends, I am Dr. Swapnil Tople. I am consultant urologist and andrologist practicing at Apollo Spectra Hospital. Today we are going to speak about the kidney stones and their management. So what are the kidney stones? It's a very commonly occurring pathology or disease in a day-to-day life. You must have seen the so many patients who are suffering from the kidney stones and they don't have an idea how to deal with them, how to treat them properly. So we'll talk shortly about that kidney stone and its management. So we will discuss point by point what is the reason for kidney stone formation, what are the symptoms of kidney stones, what are the diagnostic tests available for kidney stone, and then the management of the kidney stones. What is the reason of formation of the kidney stone? So there is a simple biochemistry behind that. You know, there are in biochemistry there is a solution and there are solutes. So if they are in a proportion, then they will mix up with each other. But if the solute content increases and the solution goes down, then there will be the precipitation of the solutes. So the precipitation of the solutes will cause formation of the kidney stones. So this is a simple biochemistry. So what are the other factors which are influencing the kidney stone formation? So one is drinking less water, which is very common factor which leads to kidney stone formation. Second is diet and lifestyle related issues. Diet in the sense the people who take more amount of oxalate in the food are prone for kidney stone formation. So oxalates are generally found in spinach, tomatoes, non-vegetarian food, carbonated drinks. So consumption of these substances will lead to stone formation. Lifestyle in the sense if you are not enough physically active or your obesity, diabetes, hypertension, these are the lifestyle diseases which are occurring on our society. These can impact the kidney stone formation. And thirdly, it can be hereditary or there are certain diseases which are prone for the stone formation. Like there is a condition called as hyperparathyroidism, which causes more of calcium deposits in the kidney and that leads to stone formation. So these are various causes of the kidney stone formation. So if a person has a kidney stone, so how will he come to know that he has got a kidney stone? So there are certain diagnostic or symptomatic clues which you can get in your day-to-day life, which will give you idea or fair idea about the kidney stone. So these patients will typically have the flank pain that will migrate to a urinary passage. Apart from that, the patient can have the fever, nausea, vomiting, and certain urinary issues like increased frequency of urination, sometimes blood in the urine, or there would be a symptom called as a obstructive or storage lower urinary tract symptoms, wherein there will be increased frequency dysuria. So these are the symptoms. So according to the location of the stone, the symptoms can vary. For example, our urinary system starts from the kidney, then there would be ureter, then urinary bladder and the urethra. So stone can form in anywhere on this pathway. So stone can be there in the kidneys, in the ureter, urinary bladder or urethra. If suppose patient has kidney stone in the kidney stone, then he will have typical flank pain. If the stone is in the ureter, that flank pain will migrate to a urinary passage. If the patient has bladder stone, then he will not have much of pain, but he will have urinary symptoms more. He will feel that he is unable to pass urine, or there is obstruction in the urine, or there would be blood in the urine. So these are the symptoms of bladder stone. And if the patient has got urethral stone or there is a stone which is stuck in the external passage, so there the patient would have the obstructive symptoms that he will feel that his complete urine is stopped. There would be fullness in the lower abdomen. So these are the various symptoms which can occur in the patient. So in day-to-day life, if any of these symptoms are there in any particular patient, so he should have a clue that he's got a kidney stone and he should consult a specialist. So coming towards the diagnosis of the kidney stone. So how will you diagnose that you got kidney stones? So now one is you have got a clue from the symptoms that patient has got a kidney stone, but need to confirm it, because once the stone is confirmed, we need other factors also. What is the size of the stone? What is the location of the stone? What is the density of the stone? So that we will come to know after doing certain tests. So what are the primary tests which are done in the kidney stone? So first and foremost is your ultrasonography, which is routinely done at any diagnostic center, wherein we'll come to know about the possibility of kidney stone and the other factors which I just briefed. So the sonography is one. Then there would be an X-ray KUB. So KUB is kidney urinary bladder. So X-ray of that particular region will give us an idea about the presence of the kidney stone. And rest of the pathological test like complete hemogram, urinary trace and creatinine. So that would give us an idea how much infection is there in the blood, urine because of the kidney stone, and is that stone hampering the kidney function or not. So these are the three set of investigation which we will be doing primarily. So once these investigations are done and the stone is diagnosed, and then if at all we need to have a surgical plan for the patient, then the next set of investigation can be performed like CT scan, renal function test, but that would be after the consultation with the expert. So urologist will guide you further about the necessity of this test, and accordingly patient will be treated. Now once the diagnosis is done, so there would be various treatment options available, and that would be discussed by the consultant or expert urologist with you. So nowadays, the good part about the urology is that urology is one of the very advanced branch which has improved instrumentation wise. The size of the instrument from last 30 years has drastically changed and gone down. Initially, we used to have instruments which were 30 French and very large size. Now over the period of time, these instruments have become finer and finer and finer. So what is the advantage of having the finer instruments? So the finer instruments will have less trauma to the tissue, less chances of bleeding, less chances of infection, and the patient's post-operative recovery would be very fast. So that is a magic of the instrumentation which plays a role in the management of the kidney stones. So over the period of time, initially they were the rigid instruments. Now they have translated into semi-rigid. Now we have got the flexible instrument. Even in the flexible instrument, we have got fiber optic, and now the latest technology is the digital endoscopes. So this evolution of instrument has played a very crucial role, and nowadays urological surgeries are performed on a daycare basis also. So this will have a lot of impact on patient's recovery, and they can go back to the work as early as possible. So what are the treatment options for various stones? If the stone is in kidney, there are various options. If the stone is in ureter, there are various options. If it is in the bladder and urethra, the treatment choices would be different. So for the stone which is in the kidney, the size and the density of the stone will play a role. So if the stone is less than 6 to 7 mm, that stone can very well be treated with the medical line of management. We can give them medicines and wait for a certain period of time and repeat the sonography to check whether stone has passed or not. For stones, any stone which is more than 8 mm and 8 mm size in the kidney should be consulted by a urologist, and in his expert guidance we should treat that. So for stone, we generally give medication for smaller stones, and for a larger stones we have various options. Like we have RIRS technology, wherein the finer endoscope goes through the urinary passage. We break the stone with a laser and put a stent over there. It's a daycare procedure, and patient can be discharged next day also. Secondly, if the stone is bigger in size and like a 3 centimeter stone, 4 centimeter stone. These stones are ideally treated by the surgery called as PCNL. PCNL is a surgery where there would be a small cut made on the back. Therein we go into the kidney, break the stone with a laser and put a stent over there. So it's comparatively invasive surgery, but since the stone size is more, we have to do that surgery, giving it a preference. So here the PCNL is a very standard procedure done over the last 40-50 years for a larger stone. For an average size stone like 10 to 15 centimeter, there is an other option called as extracorporeal shock wave lithotripsy, wherein we break the stone by the ultrasonic waves which are focused by a external machine. The advantage of this procedure is that we don't need to do any invasive procedure. It can be done as a daycare, and there would not be trauma to the kidney. So, but the disadvantages could be if the stone is hard, the stone takes a lot of time to break or may require the multiple stitchings. So these are the options for the kidney stones. So according to the patient's preference, stone characteristics, the expert urologist will give you preferences and choices. According to that, it will be a shared decision making between doctor and the patient. If the stone is in the ureter, then in that case, we will have a standard procedure called as a URSL, wherein a semi-rigid or flexible ureteroscope is inserted through the urinary passage and stone is fragmented with the laser. For a stone which is there in the bladder, would be similarly treated through the endoscope, and it doesn't require the stent positioning. So it is a daycare procedure provided the stone is average size like 4 to 5 centimeter. For a larger stone, maybe a open surgery is recommended. So we have briefly seen these treatment options. Now coming towards the prevention of the stone formation. So this is the most important aspect, because many patients, they come, they treat the stones either by medicine or surgery, and they never come back or bother whether they will have a recurrent stones and then how to prevent that aspect. Because once the stone is formed, that patient is more likely to get newer stones. So in that way, we have to focus more intensely on the prevention of stone formation. So stone prevention would have definitive strategies. So we generally advise the patient to get the stone analysis done. The stone which is removed during the surgical procedure is sent for the analysis. So which kind of stone it is exactly, what is its composition, and accordingly the diet chart or diet recommendation is given to the patient so that he or she would follow it lifelong. These precautions would be for the lifelong, because the stone which is formed now can have recurrence after any point of time, let's say after 3 months, 3 years or 30 years, whatever it is. So recurrence is a real risk. So we should focus more on it. So one is chemical analysis of stone formation. Secondly, the stone which is already removed or still in the body, these patients are generally have the calcium oxalate stones. The other sub-varieties can be uric acid stone, oxalate cysteine stone, or infective stone, what we call as mixed stones. So according to the stone types, the diet would vary. For the calcium oxalate stones, we have to restrict the oxalate content of the food. Like as I told earlier, spinach, tomatoes, non-vegetarian food, carbonated drinks, caffeines. So that has to be avoided. For the uric acid stone, specifically it is formed because of the taking animal proteins like white meat, red meat, or even the fish will cause formation of the uric acid in the body, and that will lead to formation of the uric acid stones. Thirdly, the xanthine stone are generally rare. So, and the infective stones. So those patients which are getting frequent urinary tract infection are prone for the infective stones. That is called as calcium ammonium phosphate stones. So these stones would be treated by addressing the concept of urinary tract infection. So these are the various types of stones, and according to the stone type, specific diet recommendation is given by the expert urologist, and that dietary recommendations are to be followed. This is the second aspect of the stone prevention. Third aspect would be to address the metabolic abnormalities. So metabolic abnormalities are like obesity, hypertension, diabetes. So these are the lifestyle diseases which are occurring nowadays. So these aspects are important to treat and deal with, because if you are a diabetic patient or obese patient, they are more risk of getting stones again and again. So there are patients who are undergone treatment 4 times, 5 times because their stones are obstructing the urinary passage. So in that aspect, we will have to treat these abnormalities also. So other experts can also help you in that, like a diabetologist or a general physician who can treat the hypertension. So these lifestyle diseases have to be avoided. The other aspect of the diet is also that the low sodium diet is generally recommended for the stone formation. The fast food which we, or the junk food which we eat on a regular basis, generally have the high sodium content. So that leads to stone formation. So the basis of the stone formation or the prevention of stone formation is that drinking adequate water. It should be at least 2.5 to 3 liters. But the criteria of drinking 2.5 liter to 3 liter may be like a blanket statement, because a person who is sitting in the air conditioned chamber would not require even a 2 liters of water because the climate is cold. But the same person who is as a laborer profession and working under the sun would have requirement of 5 liters or 6 liter also, because his body is getting dehydrated. So the water intake would vary from person to person. But how would you calculate the water intake then? So water intake is generally calculated by the urinary output. So generally a person should have 1.8 to 2 liters of urine output. It should be clear white. If it is going towards the yellow tinge, in that aspect, the patient is getting dehydrated. So we have to address that concept. So 1.8 to 2 liters of urine, white color is recommended. Secondly, there is a myth about the drinking alcohol, or for that matter, drinking beer would help in kidney stone or not. So this is an important aspect, because lot of people will in neighborhood give you advice that you drink water excessively, you drink beer along with that for the stone expulsion. So this advice is given. So is it right or is it wrong? So see, beer is like is a basically a double-edged sword. So why double-edged sword? Because beer has a maximum content of oxalates, so it's prone for the stone formation. And the other aspect is that beer has a diuretic effect. So if a stone is stuck in the ureter and it is not getting removed, because of the beer, the excess amount of urine is formed and it is pushing or creating a hydrostatic pressure so that the ureteric stone should come out. So that's the theory of the beer. So coming to the basic concept, that it's a beer forms the stones but helps in pushing out the ureteric stone. So that's a double-edged sword. So beer is not recommended for a patient who has the kidney stones. Thirdly, there is a myth about the vegetables or fruits. So a lot of people say that the fruits or vegetables which have seeds should be avoided. There is no scientific logic for that, because blanket treatment avoiding all these seeds or containing fruits or vegetables should not be done, because there is no scientific logic for that. So friends, we got an idea about stone management, treatment, and the prevention. So what is the final statement or the verdict about the kidney stone? So you should have adequate water intake. You should have lean protein, less of animal protein, avoidance of beer, and having the green leafy vegetables except the spinach. So that's the complete advice for today. I hope I have answered all the aspects of the kidney stones. If you have any queries or questions, you can get in touch with us at Apollo Hospital, Chembur. We would be happy to help you in treatment of the kidney stones for the healthy kidney. Thank you.
you.